My name's Brigham Bruff. I was born in Vermont. I've been living in Providence for 15 years. I went to Brown and graduated from the music department there, and that's where I fell in love with the upright bass. Toured professionally for about 8 to 10 years, playing bass and other instruments. In the interim, I always did some woodworking here and there to sort of fill the gaps, and in the last 3 or 4 years, I've been doing more carpentry, and music has been kind of filling the gaps. The connection of music and design work is through my hands. My left hand is very dominant on the bass. That's where the notes are made. I'm right-handed, so in the design build world, I use my right hand a lot. It's crucial to have all of the digits working to be able to execute most tasks. About 8 months ago, I amputated the end of my left pinky completely off, cut the pads of my ring, middle, and thumb fingers very badly in an accident at my house while I was working on some of the last items in a renovation that I've been doing. I was outside and called to my fiancée, who thankfully was home. She came downstairs and had the peace of mind to help me find the finger, clean it off quickly, put it on ice, and delivered me in her vehicle to Miriam Hospital, where they stabilized me and brought me to Rhode Island Hospital. I consulted with Dr. Zenowitz before surgery about the specific use of the pinky in playing the upright.
With Brigham, myself being a guitarist, I knew what was required of that particular finger, but even more so for a bass player because of the pressure and the angle that was required, that he was going to have to be able to have a really stable joint.
Each note you play, you're adjusting constantly with your left hand to find that note, unlike a fretted instrument like a guitar or even electric bass. The doctor was able to reconnect all of the vascular structure.
The degree of difficulty at the end of a finger, on the smallest finger, where the vessels are the tiniest, is considerably more.
Remarkably, he was able to stitch all that back together on a microscopic level.
We're talking about the very finest suture material. You need an operating microscope to be able to see it.
Within a few hours, I was waking up in the recovery room and the finger was back on in the position that it needed to be. A whole step is really between your pointer and your pinky finger, and that right there is why I went through all of this. After about 8 months of recovery, I'm actually able to do all of the things that I communicated to Dr. Zenowitz on that night. I was probably out of the shop work for 4.5, 5 months before I was strong enough and comfortable enough to be back in the shop. Any one of these tools can really do a lot of damage, and it's been a great reminder of safety and attention to have lived through this and recovered as well as I have. I can't really express my gratitude towards the plastics team in a few words, but I would say that the absolute best outcome is what I got.
Brigham today tells me that his function feels like it did when he was playing before, and he doesn't really notice true loss of function. I can't ask for more than that.
I've gotten far enough to be able to be performing publicly again. I couldn't ask for any better results.